I'm a patient at AJ Plastic, and the reason I'm here is for a procedure called Gynaecomastia. And the reason I wanted to do it is because I've been battling with weight loss for a couple of years. Just a little history, I was obese all the way through primary and secondary. Then after secondary, I started my weight loss journey in 2008. So it's been a couple of years and a little bit over 10 years. I shed a lot of weight, about 25 to 30 kgs. But the issue is the weight was not going away on the chest area. So I decided to do some research, and I found out about the procedure, Gynaecomastia, and decided to do a little bit of research. And after a few months, I landed on AJ. I was actually referred by a friend, and to be very honest, it wasn't easy to make that decision. But just like depression or any other disease, so as we embrace things like counseling, I decided it shouldn't be a big deal, and accepted the issue, decided to seek some help. One of the main reasons was, I can say, confidence. I do a lot of extreme sports, and let's say, for example, you're at the beach, you're jet skiing, you're skydiving, sometimes you need to go shirtless or have a vest or sleeveless, and it kind of eats into your confidence a little bit. So I decided if there's a solution, why not try? Good morning. I'm a patient at AJ's, and yesterday already went through why I decided to do the procedure. So we are done with the procedure. It took about 3 hours. Very painless procedure, and to be very honest, I'm very happy with the results. The recovery is quite a little bit, let's say, uncomfortable and painful, but it's subsiding. It's being handled and managed well, and to be very honest, the procedure is all worth it. So for the men out there, or for the ladies who are suffering through for the same, I would like to encourage you, don't be afraid. It's just like a disease like any other. So yeah, give it a shot and welcome. You won't regret the results. Thank you.
Welcome to AJ Plastic Surgery Center. Today we are going to talk about Manboobs, also referred to as Gynaecomastia. This is a condition that afflicts men, where they have, from the word Gynaecomastia, they have breasts that have feminine or have features of female. It usually affects two age groups. We have the post-pubertal, just after puberty, where with the changes, with the hormonal changes and what we call differentiation and characteristic, development of sex characteristics, you have an overgrowth of male of the breast that should involute or should go back, but when it doesn't go back, where it persists, then we develop the gynaecomastia. Then we have another subset of patients who, especially after massive weight loss, massive weight gain and then weight loss, you have a persistent of breast mod or breast mass in a certain population of men. And that is what our current patient is having. And that is a patient who had excess weight that has lost weight, and then you have persistent of breast tissue or breast mass. Most of the time the condition is not cancerous, and the preferred treatment is surgical, because there's no drugs that one can take. There's no medication to take to cure it. So you have to go in and remove them using various surgical techniques. What we employ here at AJ Plastic Surgery Center is what we call liposuction assisted excision. This is where you do the normal routine liposuction of the breast, because the breast tissue has fat, the gland and the skin. So you do, especially grade 1 and 2, liposuction, and then you reduce the mass, then use a minimally invasive or just a small incision, less than a centimeters. You approach your breast tissue, you remove, and then you reconstruct. And with that, you expect recovery, full recovery, and a flat chest, because that is what most people would want. Such patients usually have very low self-esteem. You find that they cannot be shirtless, so they would fear swimming. Some sports like football, where you have to play shirtless, or just have a tight-fitting outfit, because that will reveal their feminine breast tissue. Recovery is quite smooth. We usually do it as a day case or an overnight stay. After that, there's compression garment that stays for about 6 weeks to 2 months. And then the healing is usually uneventful, with almost invisible scars around the areas. However, in men, whereby you find them, they have unilateral breast mass, that is breast on either side, right or left, with a normal chest wall on the other side, that it's very suspicious, and most of the time could be an indication of breast cancer, which as much as it's less common in men, it does appear. So anyone who has a breast swelling that is excessive on one side should actually seek medical attention.